If you've been around this channel for a little while, you've seen me go from a nutrition only approach to a holistic lifestyle approach, and now we're going a layer deeper. So stay tuned. Welcome back to the Sarah Kleiner Wellness YouTube channel. Today I have on Dr. Melissa Sell, and we are diving into German New Medicine and some of the implications that traumatic events and emotions have on our health. Now, this is a topic that does take a lot to kind of wrap your brain around. So just listen and have an open mind. I think that's the most important thing for people, and kind of where I've gotten to in my health journey. And when I have children, my children's health and trying to help them the best that I can. They've really been the catalyst for me continuing to dive deeper and wanting to learn more. So I hope you enjoyed today's episode with Dr. Melissa Sell. All of her information will be down in the show notes for you. And before we jump into today's show, I just want to thank a couple of sponsors very quickly. The first one is going to be Viva Rays. You can use my code YOGI to save on their circadian glasses, as well as their eye masks, earplugs, as well as low EMF headphones. They are a fantastic source for this. And the second sponsor of today's show is Upgraded Formulas. You can use my code YOGI12 or YOGI to save there. They have a fantastic magnesium supplement that actually bypasses the gut. So if you're someone that has gut issues and magnesium is always an issue, this is a fantastic solution. They also have a hair tissue mineral analysis with a consultation that I recommend if you suspect you have mineral issues. So check them out. And if you are enjoying today's episode, make sure to go down and leave us a comment, like the show, share the show. And thanks again so much for watching. Let's go ahead and jump right into it. Hello, everybody. Welcome back. I am very excited to have Dr. Melissa Sell here with me today, who many of you in the community have requested that I talk to. So thank you so much for being here today.
Thank you for having me. I love any chance I have to share the 5 biological laws and kind of just get it out to more people. I am always delighted. So thank you for inviting me.
Yeah, it's so just speaking of that, like what in the world is that? Or do you want to maybe just give some of your background and then we can jump into these 5 biological laws, because I'm definitely intrigued.
Totally. So yeah, like we just said before recording, is I started my kind of journey as a chiropractor. I went to Life University in Atlanta. I graduated in 2012. I practiced all things holistic health, so chiropractic and detox. And I would take people on tours through grocery stores and buy this, don't buy that. And I give workshops every week on the things to, clear out of your home, the toxic things, how to live more naturally, all of the healthy living things too. And so that was my full-time, work for several years. And my partner and I, who's also went to chiropractic school, he never practiced. I practiced full-time for several years after school. But he, as a result of our synergy and what was going on with us, we kind of got really interested in internal experience. So perception and, because despite doing all the external healthy things, I still had a lot of stuff going on inside, a lot of anxiety and fears and worries and relationship problems that it was not being addressed by simply, eat this, don't eat that, do these exercises, get these adjustments. And so I went on a journey of like deeper inner work for myself. And I saw how beneficial that would be for my patients if they kind of like, went deeper beyond just, yes, we want to do all the healthy living things, but there was like more to the story. So he and I started that kind of work for ourselves. And we started to develop systems and tools to teach people to kind of get into the inner workings of their psyche, of their mind. And then one fine day, I was still working, kind of teaching holistic health and, natural living. And I was listening to a podcast about magnesium supplementation because I was giving a workshop. I was just doing some research. And so Dr. Carolyn Dean, who wrote the book, Miracle. Yeah. So she's being interviewed by someone on a podcast, and they asked her about cancer. And she briefly mentioned German New Medicine.
Yes.
And we carried on with the interview. And I was like, what the heck is that? I had at that point been in the holistic health world for 12 years. And I was like, I've never heard this. No one's ever talked about this. And so I went down the rabbit hole and I was like, oh my goodness. I was shocked that I had never heard of it, that like nobody's talking about it, because this system, these 5 biological laws, this map for understanding how the body works makes more sense than anything else I have ever encountered. And so my mind was blown. And then since then, I've been studying and teaching and integrating, and it's never been incorrect. It's always been 100% accurate. And so this is a system that I teach now. This is the map, the tools that I believe that every holistic, natural, wherever you are and whatever you do, you need to check out this map.
I think this is going to be really interesting to hear about, because here's the thing that I think a lot of my listeners resonate with is that they understand holistic health. If you're following my channel, if you're, listening to the show, you're not dumb about these things, right? I've had so many different guests on with different viewpoints. Dr. Tom Cowan, I'm doing his new biology curriculum right now. So the audience, they understand, like, can do all the things with the toxins and the detox and the parasites and the mold and all that, and still be completely jacked up, right? to be frank. And I encounter these people daily, that are, I've done a parasite detox, heavy metal detox, and this, that, and the other. I still feel terrible. And, what I say is you haven't addressed the organism, right? Making the organism robust and able to just naturally handle these things. So I would love to understand, how you approach these things, and if I'm on the right on the right track or on the right path, and kind of understanding what it is that you do.
Yes. So we have to talk about Dr. Hammer's story, because this is like where it all started and what allowed him to put these pieces together, because basically he just did this huge level pattern recognition of what's happening in nature. And it all started with a tragedy in his family. 1978, his son and his daughter are off on this trip, and they're on a boat, and they're just kind of having this great old time. And this crazy situation goes down. There's actually a documentary on Netflix called The King Who Never Was, which goes through the drama of this whole story, where the exiled crown prince of Italy, he shoots a gun. There's this whole boat situation. They're on a boat. Dirk Hammer, Dr. Hammer's son, is just sleeping on this boat. This prince shoots this gun off. It goes through the wall of the boat and hits him like in the abdomen, and his femoral artery. And he gets, taken to a hospital, and his leg is amputated, and they try to keep him alive for like 3 months, and he ends up dying. And obviously this is a huge tragedy. He's just a handsome young man, and 17, and his father obviously is completely devastated by this situation. And after the loss of his son, Dr. Hammer developed testicular cancer, and he's always been healthy, no cancer in the family. And so he just knew that there was a connection between this tragedy and cancer, but he didn't know exactly what it was yet. Until 2 years later, he was working in headed up an oncology unit, and he had access to a lot of cancer patients. And so he started to ask them, did something traumatic happen to you? Did you lose someone prior to your testicular cancer? And everyone was like, yeah, every man had some type of tragic loss. Every woman who had a glandular breast cancer had some type of worry in her home, worry for her child, an argument happening in her nest. Everyone who had lung cancer had some type of death fright, death of someone they care about, death for themselves. They were afraid. And so he started to piece together that these cancers are not random. They're not happening, just for no reason, that there is a map, that there is a reason, that the body is doing something intentionally. So that's like the big picture of understanding the 5 biological laws, is that nature is ancient and wise, and it does what is necessary to survive in a shocking situation. And so when we have a conflict, a trauma, something that catches us off guard, every tissue of the body has a biological purpose. Everything that's here is here for a reason. It's doing a job, and it has the capacity to shift into like a turbo mode. And depending on which tissue we're dealing with and which type of shock that we have, the tissues behave in specific ways, which can, if it's intense enough and if it goes on for a long enough time, be diagnosed as what the conventional world sees as cancer. But he went on to find out that it's not just cancer, but it's every tissue. So a pimple, a hemorrhoid, a sty in your eye, losing your hair, having a rash. Every tissue has a conflict that is the source of the adaptation. And so when we start looking at symptoms, so you ask like, how do you work with this, is when someone presents with a symptom, we look at the tissue type, and that tissue tells us the experience that the person went through, the conflict that caused their tissue to adapt, to go into turbo mode, to change its functioning for a survival purpose. And so when we start seeing every symptom through that lens, we don't have to be afraid. And we know we can pinpoint where we need to go, where we need to do work, where we need to evolve, change our environment, change our situation in order to resolve the conflict and get back to normal homeostasis and normal tissue functioning.
Fascinating. Yeah. And it's so crazy because I have experienced this in my own life, and I know a lot of listeners have as well. Like my mother got a non-Hodgkin's lymphoma the same year that my father passed away, a pretty tragic death. And she had been for years kind of this like, the one who was carrying the family and doing all the things and super stressed out and working 14-hour days. We don't have a lot of history of cancer in the family, but all these stressful events and all this stuff happened. And all of a sudden she's got non-Hodgkin's lymphoma. She's completely incapacitated. And, we were told she wasn't going to make it through. She's still here today, thankfully. But that was the first time in my life that I started thinking like, my mom's just been through complete hell. Like it has to be related in some way. And I think people, maybe they listen to Dr. Gabor Mate, like a lot of his work, and understand how like there's a trauma piece in health. But I love Dr. Gabor Mate, but what I don't get from his work is a pathway through this, right? For people who are experiencing these issues, this trauma, like what it is that they're supposed to do while this is going on, right?
Totally. Yeah. And so it's when we can pinpoint, this is what this trauma is about. This is what, so if someone is dealing with anemia or leukemia, we have to look at self-devaluation. If someone is dealing with prostate cancer, we have to look at, where they're feeling less of a man, what is the biological purpose of this organ? So the prostate, adds prostatic fluid, and it causes you to have kind of a greater musk. And it's like, okay, how are you feeling less like a man? Is it an issue with the dynamic in your relationship? Are you being demeaned? Is it an issue with your offspring? Are your children choosing not to have children? Or do they have some type of health concern? They have conflicts of their own that's preventing them from having children. And now, you're a man in your 60s and you're like, is my, line going to carry on? And you're having this conflict. So the prostate enhances, or the bone, so we have to look at what's the organ. What does that organ do? How is it adapting? Because it's like when we can't handle things in our life, when it's too much for us to adapt to psychically, the body takes it on. It moves into an adaptation in order for us to survive. And we can see the benefit in this. We have to look at our ancient ancestors, that every adaptation that allowed the species to continue is programmed in. It's like, this is a good backup. This is going to allow us to stay safe and stay alive and be able to reproduce and carry on, life. And so that's the life principle is survive first and foremost, and reproduce, survive and reproduce. So everything, when you can look at your symptom through the lens of how is this adaptation engineered to help me to survive and to reproduce, you don't have to, again, that fear. So, the non-Hodgkin's, looking at the fear of being powerless, heading into danger heading towards me, and looking at the specific symptoms and how they show up is, it's so amazing to help a person to look back at that moment in time where they were shocked, where they were, part of the first biological law is the kind of essence of the conflict shock. And so this isn't, and, a lot of people will kind of get scared sometimes when they learn about GNM. They're like, oh my gosh, every time I'm panicked, I'm going to make cancer.
Right. That's.
And it's not exactly like that because, stresses that we can predict, things
Mm-hmm.
that we know we're going to be dealing with, that's not a shock. That doesn't catch us off
Mm-hmm.
guard. Yes, it can deplete us. Yes, it can make us more susceptible if we kind of are living in a lot of stress and we're constantly at our emotional threshold. That can make it easier for us to be caught off guard by something. But stress, like as we kind of speak about just stress in general, that's not the cause. The cause is a moment where you are shocked, where you are caught
Mm-hmm.
off guard, you feel totally isolated, totally alone, unprepared for that information, for that text, for that thing that happened. It's that shock moment that initiates the adaptation program. And Dr. Hammer actually found if you do a CT brain scan, you can see an impact. So this is like an objective criteria that if you can have a CT brain scan performed without contrast, you can see a ring formation. It looks like a pebble dropped into a pond. So a ring shape will show up in a certain region of the brain, indicating that that program has been activated. And Dr. Hammer, he could look at a brain scan and see basically like the fingerprint, the map, the history of every kind of conflict and thing you've ever gone through actively or have already resolved. And so that's another amazing tool that can be used to analyze and to see, what's active, what's been resolved, where are you in this adaptation process.
Fascinating. So he uses CT brain scan essentially to assess people's level of trauma, what's gone on, and how they've been able, if they've dealt with it or not, essentially, right?
Yep. And he was able to, they did. He has several. So, one of the big things about this is the suppression by the medical establishment, so he comes up, he writes this thesis in 1981, he submits it to the University of Tübingen, and they don't even look at it. They don't officially look at it. Years later, he found out, like, behind closed doors, they validated it, but the medical establishment cannot acknowledge these 5 biological laws because it undermines everything about conventional medicine. And so all the textbooks would need to be rewritten, all of the treatment protocols, all of the things that we have built our understanding of health upon changes when this gets integrated. And so, but he has had several independent university trials, basically. So he'd go into this university and there'd be like a panel of all the university doctors, and he'd have a brain scan, a person's chart, and the person, and basically he could see exactly what was going on with them and got approval. But it's kind of like informal, approval, but it hasn't been taken in widespread by the medical world, again, because who wants it to?
Right.
No one's going to benefit from this except for the people. And that's why this is very much a grassroots, learn this for yourself type of model, taking it upon yourself to understand how your biology works.
Absolutely. Yeah. And so I think the big question is, like you mentioned earlier, people are worried, like, I'm going through this huge stress. I have no control over it. I know that my body is going through a lot right now. What can I do to keep my health intact and weather this really stressful situation? Does the model kind of take someone through that?
So the model in and of itself, the treatment is in understanding why I'm in this state and getting back to a more biological life. So Dr. Hammer had a lot to say even about just kind of political and societal structure and how everything about modern junk society is, almost engineered to keep people sick. And conflicted, money problems, the way that children are birthed, daycare, all of the separation. We have to look, this is a system of living in harmony with biology. It's biological, it's life logic. And so we live in an illogical society where we separate children and parents, and we do not have a harmonious family, and parents have to work 14 jobs in order to, keep food on the table. And so we've got scarcity, we have fear, we have separation. Everything about our modern world is not conducive to health and harmony and family and connection. And so it's kind of radical when you really look at this and you take an inventory of the stresses in your life and you look at, how am I living out of harmony with nature and with biology. And what's it going to take? And that's why most people turn to drugs. We turn to the quick fix because we are in survival mode. I don't have time to do deep inner work and heal my abandonment wounds and heal my separation conflicts because my parents lived unnaturally and I was dropped off at daycare and I wasn't given that kind of solid foundation. So I just feel ambiently anxious in my life because I didn't have that firm foundation. And so that does take inner work, that takes spiritual healing even because, we have to do the practical biological change. So again, if you're working a job and you're not with your children and your children are sick and suffering, because you're not with them, it's like, what's the solution? Quit your job, be with your kids, find another way to, to make your income. And that is extremely, it's definitely possible because people are doing it. So never think that it's not possible, but the mind says it's not possible. Society says, your family says, so we've got a lot of elements that aren't supportive of us resolving our conflicts. But, there's many things that you can do. So if you're listening to this and you're like, I'm the person, I'm in that situation.
Yeah.
There is a resourceful way for you to interact with your life as it is. And that's really, my teaching. So I teach the 5 biological laws, but I also have programs simply about engaging resourcefully with life, thinking in a way that is more resourceful, believing that it's possible for you to change your outcomes by changing your mindset, your attitude, your perception of the world. And so, I kind of help people on both ends, first learning the kind of foundational biological map, and then learning how to think. How can I interact with my life in a way that feels more empowering? Because disempowerment, feeling powerless, I can't do anything, self-devaluation, I'm broken, there's something wrong with me, I'm never going to get it right. Those are 2 like underlying foundations of most every conflict. And so we have to find a way to rebuild your self-esteem, rebuild your self-efficacy, show you the things that you can do so you kind of can start building a foundation of, optimism for creating a future that is worth living.
Fascinating. Yeah, I think I will probably get people in the comments because I do look at my comments. I probably shouldn't do that. But I do get a lot of people that even with my work where I talk about the importance of circadian biology and connecting with the earth, grounding, sunlight, all these things that are mostly free. I get a lot of people that really, I don't want to say they're kind of arguing for their limitations and they get angry when I talk about these things. And I get it. It's like you mentioned, people are under a tremendous amount of stress. They have jobs that they're tied to, they feel they're tied to, and mortgage and car payments and credit card debt and all of that stuff. And so basically what you're saying is you kind of help people work through a lot of those layers in the work that you do. Is that right?
Yes. Giving you ways to look at because again, most people are in a victim mode, that's like the world is against me and there's nothing I can do. And there is a sense in which that may be true, again, society isn't set up for you to succeed and to thrive. It's set up for you basically to be a slave and to suffer.
Yes.
But there are things that you can do. And just by believing that there's ways that I can begin to interact with my world. Because if anybody's ever done it, that's why we love, like a comeback story, a person who, was at rock bottom and then, built a wonderful life because it shows us what's possible. So just by believing in what's possible for you, notice when you're arguing for your limitations, it's like, wow, yeah, here this lady's giving me some great advice of things that I can, simple things that I can do. Go out in the sun, put your feet on the earth, like get yourself more in harmony with your nature, with how your biology adapts and thrives. Just start doing a couple of those things. And you say, well, I can't do that because of observe that. My work is about awareness. Observe a part of your mind say, this is bullshit and I can't do that. And, notice that and be curious. Say, is that serving me? Is it helping me to have that thought? Is there another way that I could interact with this information that I'm getting for free on the internet?
Exactly. Yeah. Just the simplest things enrage people that this morning I had a post that basically was like why I don't drink coconut water in the winter. And it was just an explanation of deuterium and how that interacts with the mitochondria and just like a little science lesson really of like, hey, doesn't grow near me. I'm in Georgia. It doesn't make sense. Like my body is less able to metabolize this and use it. And I got so many angry folks. And I'm like, gosh, that takes a lot of effort to get angry about a stranger on the internet providing you with information that you can simply just take it or leave it. And I even said in the comment, like in the explanation, like, hey, you can do whatever you want with this information. I'm not going to judge you. If you enjoy coconut water in the winter, please enjoy it, have it. But I'm just telling you why I don't drink it, and give you a little explanation around the science, right? And circadian biology, how circadian biology interacts with our biology and with our food, and why seasonal eating makes sense from this lens. However, it just, some guy said I was clout chasing. And I mean, really, it's kind of shocking when I know you get it too from where you're sitting, but you have to think about that. What I try to do is have this lens of compassion of like, this person is really got some stuff going on in their life that they have to make an argument or a negative interaction with a perfect stranger on the internet, right? Like, what is that doing to their health?
Totally. And that inability to even reflect on the fact I'm engaging with this in this way, in this moment, again, it reveals that level of incapacity, that this petty drama that I'm getting involved in, that this is what I'm spending my time on. It's some form of low level entertainment, a dopamine hit,
Yes.
I gotcha, or I love to, people love to tut and you're this and you're that. And they just don't have that capacity to reflect, but some people do. And, we're here to speak to those people.
Yes.
And it's great when someone comes out of that, or they can start to see, wow, like I do a lot of I'm in the comments section a lot.
Right.
And it's not serving me. Maybe that's not the best use of my energy and my resources.
Exactly. I hope you're enjoying today's episode with Dr. Melissa Sell. Just a quick little reminder, I have lots of free resources if you are new here, if you just are getting started on your health journey. You can go to my website. It's www.sarahkleinerwellness.com and go to free resources. I have several free ebooks up to 13 pages long that I've worked really, really hard on because I believe so much in this information and want to get it out to as many people as humanly possible. So if you do enjoy the things I talk about on this channel, make sure to check out those free resources. And as I mentioned in the introduction, all of Dr. Sell's information will be linked in the show notes if you are looking to dive deeper into her work. Let's go ahead and jump back into the show. Thank you again so much for watching. Yeah, I mean, and how is that impacting your health? Because I always see like whatever I'm throwing out there, however I'm treating other people, or the energy that I'm putting out there is that impacts me. It impacts my health. It impacts my family. And I don't know that people kind of look at life or their health through that lens. I think they get kind of swept up in either the allopathic model, which is very like, biochemical, and then even the functional medicine model, like you were talking about with chiropractic and toxins and all of that stuff. They get into this control space, of having to control everything. And like you said, go through the grocery store. This is good. This is bad. And I have so many people, and I have a private community of people, and it's like a disorder almost of people just hyper focusing on these things, thinking like, if I just get like this list of things right, my health is going to be perfect and I'm going to get rid of these things. So how does what you're doing now kind of step away from that sort of thinking and that sort of living?
Yeah. So we have to look at like the rigidity, the dogma, the lack of freedom, because a lot of times people they think if I just check these boxes, if I do this, and I try to help them to see how that is. It's like a religion. And so we're taught if we do the good thing, we don't do the bad thing, we'll be rewarded with that. And so starting to see that, the adaptations of your tissue, it's not a punishment for bad living. It's not a punishment for, because this is how I used to think when I was in that world, is I thought that if I got a sore throat, it's because I'm being punished, basically, because I had the organic peanut butter cup, but it's got sugar in it. And I had this whole idea. And I would teach this to people in my seminars when I was in Atlanta. I'd be like, oh, you can't eat sugar, because when you eat sugar, it paralyzes your immune system, and then the bad bacteria take over. And that is how you get sick.
Right. It's a biochemical model, right?
Exactly. Now I see it completely differently, is that when I have an idea of like, I shouldn't be swallowing this. Ooh, I really shouldn't be eating this. I'm conflicted about eating this. I can't swallow this. I shouldn't swallow this. It's that thought. It is that split energy, that conflict of, ooh, this is bad for me, and so I would get a sore throat because I'm like, I shouldn't be swallowing this. I was conflicted about swallowing something, and my body would go through an adaptation of widening the esophagus in order for me to better swallow it down or spit it up. And then the tissue would repair. And so most symptoms that we experience occur when the body is in the repair phase, when the tissues are rebuilding themselves. So this map shows us there are old brain tissues and then new brain tissues. The old brain tissues respond with cellular proliferation. So additional tissue grows.
Yeah, they decide to just continue living on, right? They never die.
Well, it's actually, they do. They are there for a purpose and a reason. So for example, everything with the yellow group, it proliferates additional tissue when you need extra juices, essentially. So if you need, like the tonsils, for example, I want to produce extra salivary juices so I can better swallow something down. The tonsils will grow. They will become bigger, but it's a temporary adaptation. It's about a morsel. So the yellow group is about I want to get this food morsel. So the classic example is like the little kid who wants to eat the cookies, doesn't want to eat the broccoli. So I want the cookies. I don't want the broccoli. The tonsils, when I need extra mucus to better ensalivate a morsel, the tonsils will grow. They will proliferate additional tissue as long as I'm in the conflict. So I'm producing more juices so I can better swallow something down or spit something up. And then once I resolve the conflict, once I get the cookies, once I get to spit the broccoli out, once I'm done with the conflict, the body uses bacteria. So this is the fourth biological law. Bacteria. So if you've got pus all over your tonsils, it's because you grew extra tonsillar tissue during the conflict of not being able to get the morsel that I want or get rid of the morsel that I don't want. And then when you resolve it, those are temporary tissue cells. And so the bacteria and the tubercular bacteria, Candida, it breaks down. So just like fungus in the woods is breaking down tissue that's no longer needed, that's what it's doing in the tonsils. And so if you have inflamed, pussy tonsils, that means that you had a conflict, you resolved it, and now the body is decomposing it. And so this is where we have to look at, what was this about? What morsel did I want to get? Sometimes a morsel can be money. It can be something that represents some type of nourishment, something that I need in order to survive. And so when you can identify the conflict, figure out what it's about, and make sure it doesn't happen again by either changing your attitude or changing the situation, you won't have to deal. So if you've got like chronic tonsil issues, like children who deal with chronic, tonsil issues, it's like we have to look at what food did they not get that they wanted, or did they have to eat that they didn't want to eat? So, because with children, it tends to be very practical. We have to look at breastfeeding. We have to look at like the dynamic and relationship with nourishment from the mother. But when you see it and you understand what the tissue does and how it goes into this turbo mode for the conflict, once the conflict is resolved, the tissue remodels itself to go back to homeostasis. It's like, it makes perfect sense.
Interesting. Yeah, I think children are the most interesting because they don't have a choice in doing a lot of things, and they are responding to their environment, and they are things manifest, and children these days now, I see they have a lot more issues, I feel like, than they did when I was growing up. I feel like we were a lot healthier, and there was a lot less technology, non-native EMF, we were outdoors more. But I feel like the society is a lot different as well. Like there's so many different factors, because if you talk to one person, they're going to say it's all this one factor. It's all the toxins. It's all the parasites. It's all the non-native EMF. It's all this, it's all that. So, your view is more like it's more of this emotional conflict that kids are having because of the way that they are, the environment that they're in. Is that kind of the more of the way you look at things?
Totally. Yeah. We even look at the moment of conception. Like, what was
Mm,
going on with these two people when they came together? Were
mm,
you wanted? Were you unwanted? Was
mm,
there a split? Was there mixed energy? Because all of that has been kind of programmed and downloaded into you. Like, if you
mm,
deal with kind of chronic self devaluation or feeling like I shouldn't exist, it's like, is that messaging that you received during gestation? I've been having conversations with people where they find out that, yeah, my grandma told my mom I should be aborted, and it's like,
mm,
oh wow. So these things have very profound impacts on the conflicts and the situations that we find ourselves in throughout our lives, because these patterns tend to repeat if we don't have a
mm,
resolution for it. So we are looking at lots of different things from 0 to 7. Children are in a theta brainwave state, and they're basically under hypnosis. And so everything that the parents are dealing with, the fights between the parents. So a big
mm.
thing I focus on in my work is communication and relationships, because I look back at your life. When did you get traumatized? When did you have conflicts? Oh, when my parents would fight. I
Mhm.
had a terrible fear that my parents would get divorced and like that. And so things like asthma in children,
Mm,
it's a scare fright and a territorial fear conflict affecting either the bronchial musculature or the laryngeal musculature. And so if parents are constantly fighting and the child feels in this fear, that
mm,
becomes a track for an asthma attack. That becomes,
mm,
so it's what's going on with the parents, what's going on in the home. If this is a crazy one, is like so many, I actually, some friend from back in chiropractic school, she posted like, how's everybody's dental health? Because these people eat so healthy, so
right.
clean,
Yep.
no sugar, no grains.
Yep.
They are, perfect dental hygiene. Their kids have cavities. And it's like, what's going on? How do my kids have cavities if they do not eat sugar?
Right.
Well, cavities are about a bite conflict. It's about feeling like I cannot bite. I can't bite back. I can't defend myself. I can't
Mm,
growl. I can't show my teeth. And so when I'm conflicted about that and I'm not able to express it, there's erosion of the dentin. And so
interesting.
we have to look at, who does the child want to bite? Often it's the parent. Or who does the parent want to bite? And the child is in that environment of, my mom can't, bite back at mother-in-law. My mom can't say what she needs to say. And so the child is experiencing that bite conflict for themselves. And so it gets super fascinating to have conversations with people. And when you pull the thread, there's always someone that wants to bite.
Interesting.
It's always the case. And that's where knowing this map, because the thing that Hammer put, he said that these are biological laws. Which means there's never an exception. Every
Mm,
tissue always functions this way. It's not a percentage of the time. There's not, sometimes it's this, sometimes it's that. It's like, how are babies conceived? There's one way. And so
right.
the tissues operate under these biological laws, and they do not deviate. And that's why understanding this map, anytime there's a symptom, yes, we have to look at, unnatural environments. Yes, we have to look at unnatural things we're being exposed to in food, because
Hmm.
it's not, we have to get back to our biological origins. We have to live
Hmm.
a biologically congruent lifestyle, which it sounds like this, circadian biology, that makes a lot of biological sense to
Right.
in harmony in that way. So yeah, we want to be taking care of that. But anytime there's a tissue adaptation, if you've got a rash, if you have any type of symptom, you have to look at this map too.
Mm,
Yes, the other stuff. Yes, take care of your nutrition, get your light,
right.
get your sleep, and do all of those things, but you have to look at this too.
Hmm. Yeah. And I see that, I see a lot of people that go the traditional functional medicine route. They've done all the testing and supplements, and they still haven't gotten results. They go to circadian biology. Things improve immensely, right? They're like, oh my gosh, I feel so much better sleeping through the night for the first time in 20 years. This is amazing. I love this lifestyle. I feel so good. But then there's sometimes the lingering issues. And the functional medicine people are like, oh, test for mold, test for Lyme, test for parasites, this, that, and the other. And I don't really like to send people that pathway because I don't believe in it personally. But the emotional route, I think, is really difficult for people to look at because there's like guilt and there's shame, especially I think parents like, that maybe they have children or teenagers that are having issues. And it's like, man, I caused this in some way, like I hurt my children, or, like, I think that's really a tough pill to swallow for people. But what you're saying essentially is like, hey, I'm not going to give you like a death sentence. When you open your eyes to this, I'm going to maybe give you more of like a roadmap to understand and come out of these issues. Am I correct in that?
Yes. And that's huge. The guilt, because that's the thing is it seems like if I open that door to
Right.
connection between emotional trauma and symptoms, I don't know if I'll be able to bear the guilt and the shame of having, unconsciously exposed my child to something that led to their health condition. And the thing about that is like, be brave. Be brave. You can have, because that's the thing is your child in their life, they're going to, be working off of a certain set of information, make choices from that set of information, and later look back on it and say, oh, I would have done it differently. That, now in retrospect, I can see how this led to a cascade of unwanted events in my life. And so your job as the parent, as the model, is to show your child, how do you handle situations where you look back and you say, hey, I would have done it differently, with humility, with grace, and because that's the thing is, if you go into guilt and shame and blame, then it create more conflicts for yourself,
Right.
and so
right.
This was huge for me with chiropractic, because the musculoskeletal system is new mesodermal tissue controlled from the cerebral medulla, and the cerebellar white matter, cerebral white matter. And the whole biological program is about self-devaluation. So when I feel broken, when I feel not enough, when I feel like I let my children down, my bones remodel, my muscles remodel, my connective tissue breaks down. And that's where chronic pain comes from. That's where anemia, leukemia, when these programs, I feel so broken, like I've done something so wrong, that's where that conflict comes from. And so we have to do our best to downgrade and not let the guilt from having made choices at a time affect us at that deep level. And again, that's all part of this navigation process. We all have to have grace with ourselves. We all have to have humility. If I was working off the resources that I had, I made the best choices. I mean, people have this problem with vaccines and birthing choices where they're like, oh my gosh, well, how could I have circumcised my child? What was I even thinking? And it's like, now they see it differently, but they have to, work on not letting that guilt affect them.
Right. Yeah. And I mean, it's having two children 15 years apart. It's like, I felt like I did everything wrong with my daughter. And now with my son, I'm trying to do everything right, but he still ended up not perfect, And so it's like, as perfect as you try to get it with no vaccines and no circumcision and no this and no that, there's still little things that are going to pop up. And I don't think you can ever get it completely perfect with any child. And you really just have to like look at the situation with compassion and know better, do better. Right.
Absolutely. And the thing is we don't come into this life, I don't believe, to have perfect parents and to live perfect lives and to have no obstacles and it's like when you look at conflict, not as like this bad thing, and we have as a tool for evolution, as an impetus to growth. And so it's like everything, I really love the concept of anti-fragility, where every conflict I've had, it doesn't break me and make me weak and pathetic. It makes me stronger. It makes me better able, have a greater capacity to adapt. And that's all it's about. It's about adaptation. Here's a challenge. Ooh, how am I going to adapt to this? Oh, my child has this health issue. How does this family line need to evolve and grow and, break a pattern? So another thing that's super interesting, there is a system called recall healing, which uses the 5 biological laws as its basis, but also looks into family tree, like what's gone on, like, because you can just come out of nowhere. You come from these lines of people who have dramas and who have like, is your child named after someone? Are they carrying energy of the unfinished business of the person that they're named after?
That is fascinating to think about. I mean, my daughter, just like my audience knows, but my daughter is 15 with non-speaking autism and we've got a lot going on right now. I'm fortunate that I'm home with both kids and, I have help and we're able to keep them in the family unit. but she's named after my dad, Alex, who had a pretty tragic, sad death, and a lot of demons like that never were dealt with, like and I'm just like, oh my gosh, the implications of of that. It's a lot to think about. And what she's had to face in her life, severely vaccine injured, and like I said, non-speaking autism, just a lot in her life that she's had to overcome, and still just dealing with a lot of issues now. And I'm like, oh my gosh, I never even considered that connection that I named her, as my dad was so dear to me, but tragic death and just a lot of demons that never were dealt with, so that's very, very interesting to think about.
Yeah, Dr. Hammer found that, so there's something called constellations. And so in the cerebral cortex, when you have a double conflict, this is what leads to like psychiatric conditions, or, things that diagnose like autism. So it's a combination, autism specifically, of a territorial anger conflict and a scare fright conflict. And so when you have both of these conflicts that occur, you shift into a changed mental state. So this can result in schizophrenia, when a person is manic and depressive, or they withdraw into autism and they don't speak. And so you look back at the different conflicts that happened, and then also, again, like the family tree stuff is super interesting. That one of the things in recall healing they say with autism is that it's like a suppressed family secret that's been around for like 4 generations. And so
wow.
Yeah. So looking into these things and just speaking about the right thing, and releasing it, and seeing what is, what's unspoken, what hasn't anybody ever said, what's been suppressed, because all conflicts, they happen again in isolation. I feel totally alone in this. And so when we give words to it, when we speak it and release it, it's amazing how these transformations can happen. And again, even within yourself, and doing it for the family line. If there's things you don't know, if there's things that are, like you can't ever know, there are, energetic ways to kind of find solutions to these conflicts and see great improvement.
So is what you teach, is it all energetic healing? Are there herbs? Are there supplements? Or is it just purely doing like the emotional work?
It's purely finding a resolution to the conflict, so that is like the biological, is like the biology needs a solution, and so we always want to find the most practical, direct, so like with children and animals, for example, you can't give them a spiritual solution. If mommy's not there, we're not going to explain to the child that they need to be enlightened. It's like, no, they need mommy. They need their biological needs met. And so we first look at, how do I need to rearrange my life practically? Do I need to quit this job? Do I need to replace the pet that died? Do I need to replace the partner that died? Do I need to get pregnant again if I lost a child, if that's what the conflict is about? Like, what's the most practical? And then also, sometimes a practical solution isn't possible, isn't, going to work for that situation. Then we need an attitude shift, a transcendent solution, a way of seeing this situation differently, so that I'm not affected in the same way. And so this is where, like we change the way you're looking at it. One, just understanding this map, because a lot of people feel like a victim of their symptoms. They feel cursed. They feel, why me? They, have a lot of self-pity about it. And so we have to look at, this is meaningful. This is happening for a reason. Your biology is not against you. Your body is always working for your benefit, for your survival. And so, that's like mindset shift number 1. This is happening for me. The symptoms are telling me something. I can pay attention to where I am in this adaptation process. And then we have to look at, how am I viewing this? What am I telling myself? What is my again, what is this inner programming that I have? Am I worthless? What did my parents, teach me? What did I observe when I was young? What was going on with my parents when I was conceived? It's like all this programming, it's through the awareness, and the teacher of recall healing, he talks about like the quantum principle of like, when you look at something, if you don't look at it, it can't change. But when you look at it, and he brings in kind of Jungian philosophy too, of like, until the unconscious becomes conscious, it keeps showing up in our life. And it seems like, well, I'm just destined to experience this. But when we bring conscious awareness, to the stuff that has happened in our life, and we accept it, we acknowledge it, and then we release it and transform it, and it gives us permission to go on to live a different destiny. When there's some transgenerational work that's very helpful for kind of processing, acknowledging that family member in the ancestry that suffered in silence, and no one ever heard its story. And so it just got suppressed through the generations. There's symbolic, energetic ways for you to just release that. So yes, it's energy. Yes, it's mindset. Yes, it's practical. It's kind of like, it's a lot of different things. It's changing your physical environment. It's living, and that's where, when people do really well, because I saw wonderful results when I did kind of the traditional holistic, eat better, exercise.
Right. I think a lot of people do see the needle moving when they do those things, for sure.
For sure. Because as you're doing it, it's not just the
mindset is like, yeah, you're shifting. Yeah. And you're aiming to get to this better place, and you're hopefully envisioning that, that's what I think is so important. And that's, I conceived my son after 2 years of infertility, multiple losses, went through fertility treatments. They all failed, and then adopted circadian biology and what I call quantum biology. And the mindset was the last thing for me, because I was doing all the things. And until I would sit in my bed at night and meditate, and literally sit like this, like I was pretending to hold this baby, and I knew it was a boy. And I was like, I'm holding my baby boy, and I had his name and everything. And I was like, until I started doing that regularly and feeling him here and feeling those emotions that he was already here, the next month I was pregnant. And I think that that's the place that people have to get to with all of this, is like, can you see yourself well? Can you see yourself in that place with that, the goal that you have in mind? I think that has to be done universally.
Absolutely. Totally. Like using your imagination for good and not evil, because if you're constantly imagining things getting worse and worst case scenario and what happened. And that's the thing, is a lot of people, when they have that, they imagine this isn't ever going to go away. This isn't ever going to get better. I'm never going to sleep again. I'm never going to be well. I'm never going to be in a relationship. I'm never. And so we have to stop imagining that. We have to start seeing the outcome that you want. So there's discipline and using your mind and directing your conscious attention and your focus to a new end. And so that is a beautiful example of like, see the thing you want happening. Feel as though it's already real. And so, yes, there's so many different like principles that we can activate in schools of thought and, spiritual, what are your spiritual beliefs? What do you believe about existence? We kind of have to go there too. Yeah. It's the biggest picture. So, there's lots of, so many entry points, so many ways for you just to chill. So much of this is about chilling out, relaxing, not living in a state of constant panic and tension. Fear. We want to surrender and trust the flow of life, so there's so many different things that you can do just to like, and if you feel overwhelmed by it, notice, oh, my mind is telling me, oh, it's so much you have to do and you're never going to get there. And it's like, watch that voice. And it's like, okay, is this helpful? Is this the only way I can talk to myself about this?
I love that. Well, I'm sold. Like, I'm ready to sign up. So for anybody listening, how can they find this work that you do, learn more? What's the best way to do that?
Yeah. So I have a YouTube channel that has a lot of great videos that you can get started on. Just look up Dr. Melissa Sell on YouTube, my website, drmelissasell.com. I have a blog post that has all the getting started with GNM, and, German New Medicine is also called Germanische Heilkunde, or Germanic healing knowledge. And so there's, there's books, there's a study course from Dr. Hammer's approved lecturer, Helmut Pilhar. And so if you're like a studier, if you're like, oh, I want to learn this whole map, I want to integrate this into the work I do, which I highly recommend. There is, you can either buy the tutorials like one at a time, or there's a bundle. And so that is what I recommend for kind of like the practical study knowledge of this work. I do teach a class on Mondays called The Language of Adaptation, where we dive in. It's a 90-minute class, and we talk about a different biological program. I'll give examples of like, celebrity health issues and stuff I see and just kind of weave it in. So like you can see, I give a lot of examples. I've been watching Little House on the Prairie about the indoctrination and the things that we, see. So it's a great forum for asking questions and really just like how do I start to wrap my mind around this? So there's that class. My partner and I also, so we teach these other classes called Resolve, and they're all about, now that I know I have a self-devaluation, I have an abandonment conflict, I have a territorial anger, these classes are designed to kind of give you strategies, tools, perspective shifts for downgrading, for seeing the situation differently. And so that can also be found on my website under courses. So, and I always have just stuff going on to like teach people and help you expand my podcast. If you're just like, okay, I just want to dabble, go to the YouTube channel, go to the podcast. There's the website, the Learning GNM website, that is like a great resource to like read about all of these things. So and that's all on that blog post. So dive in. I mean, it's a whole entire world. It's going to rock you. It's going to kind of like make you change certain ways that you look at things, but it's so worth it because this map is so consistent. It is based in embryology. I mean, the embryology aspect of it just blew my mind. So it's such cool stuff. And so I'm very excited for your audience to check it out and to dive in.
Awesome. And I'll make sure I put all those links down in the show notes because I know people are definitely going to be searching for it. So thank you so much for being here today. It's been amazing to chat with you.
Yeah. Thanks again for having me. Super fun talking with you too.
Thank you so much for listening to today's episode. I really enjoyed it. And like I said, I had to wrap my brain around a lot of the stuff she was saying. I'm still kind of processing it, but I think it's really interesting information and another thing to take into account when we look at our overall health. So again, check out all of her programs. They're going to be linked in the show notes for you. And a quick little thank you to my sponsors, Viva Rays and Upgraded Formulas. And a reminder that you can get all of my free resources on my website, www.sarahkleinerwellness.com, if you are looking to get started on your health journey and you're not ready to take the plunge by buying a course. Lots of free ebooks for you over there. And if you did enjoy the show, please head on over to Apple or Spotify, leave the show up to a 5-star review. And if you've already done that, thank you so much. Please share the show in a Facebook group, Instagram, with a friend, with a family member. Word of mouth is the best way to get this important information out there. So thank you again for listening. Thank you for being part of this amazing community. And I look forward to talking with you again very soon.